All right, so week 1. This is in regards to the Arizona State Board of Pharmacy. It basically just says why licensure is important in the world of pharmacy technicians. These next few slides are basically for the class that I teach on the side. If you're interested in maybe taking a class online, let me know. Leave a comment, and I'll discuss that with you. This video will only be up for 12 hours after it is posted, so we will, hopefully you'll be here, hopefully we'll get some people to see this. So the training program talks about the laws that govern pharmacy, how drugs are dispensed, what dosage forms are common, how each drug fits into the respective class, and how to calculate everything from concentration to percentage discounts. In the class, you're guaranteed to pass the pharmacy technician exam board test, as long as you get 80% on the quizzes and 85 on the final. Again, those quizzes and finals and tests are for the class that I teach. This is how you sign up for the Arizona Board of Pharmacy. You go, or the test. You go to ptcb.org. All right, so the first thing we'll talk about is the parts of a prescription. Page 22 is in reference to the book again. So on each prescription, there's going to be the patient information, the full name of patient, address, and date of birth. SIG codes are not to be confused with the signature, the doctor's signature, or the prescriber's signature. This is a portion is sometimes preceded by the abbreviation SIG. This is going to be the directions of how the prescriber wants the medication to be taken. It may include number of dose units per dose, route of administration, frequency of dosing, duration of dosing, purpose of the prescription, any special instructions, and any warnings that may pertain to the prescription. Prescriber's signature needs to be on every prescription. The prescriber's signature is required to make the RX a legal document. Usually the prescriber will indicate his or her degree, if not pre-printed on the RX blank. The prescriber will usually indicate on the face of the RX in some way whether the brand is to be dispensed or if generic substitution is permissible. This will typically be shown by DNS, DAW, do not substitute, brand medically necessary. All prescriptions also need to have the date written. All prescriptions expire after 1 year from the date written. Controlled substances expire after 6 months from the date written, and C2s, there are no refills. C3s, C4s, and C5s may refill up to 5 times. Prescriber's information, that's going to be the name, the address of the doctor's office, the prescriber's office, the phone number, and the DEA number if required for a controlled substance. Some common SIG codes that we're going to need to memorize is, these are just a few of the common SIG codes that need to be memorized. This is going to be your dosages, this is going to be your routes, etc. All right, so the next important thing is going to be your dosage forms and definition. I would mainly focus on the dosage form and the definition, basically get an idea of what each one does. So the first one's going to be aerosol, the system consisting of a suspension of fine solid or liquid particles in air or gas. Balsams is a resinous substance containing benzoic or cinnamic acids of their esters. Capsules, solid dosage form in which the drug is enclosed in either a hard or soft soluble container or shell of a suitable form of gelatin. Cream is a semi-solid or thick liquid emulsion containing medicine dissolved or suspended in the emulsion and intended for external application. Elixirs is going to be a clear, sweetened, hydroalcoholic liquids intended for oral use. Emulsions is a dispersed system in which one liquid, termed the dispersed or internal phase, is distributed in small globules throughout the body of the second liquid, termed the dispersion media or external phase. Lotions is a liquid preparation intended for external application to the skin. Ointments is a semi-solid preparation usually containing medicinal substance and intended for external application to the body. Ointments are not water soluble. Parenteral, these are going to be your injectables. So your parenteral is a product that is injected directly into a fluid system of the body. The term parenteral means to introduce a substance into body via means other than the GI tract. The different routes of parenteral medications are going to be either intravenous, intramuscular, subcutaneous, intradermal, and intraspinal. More dose forms that are going to be important to know are going to be your pastes, which are ointment-like preparations for external application characterized by the presence of large amounts of powder. Solution, one-phase system of two or more substances combined yielding total dissolution. Ophthalmic solution is a sterile solution free from foreign particles and suitably compounded and dispensed for instillation into the eye. Preparation of ophthalmic solution involves careful consideration of factors such as the inherent toxicity of the drug itself, osmotic pressure, the need for buffering agents, the need for preservatives, sterilization, and proper packaging. Spirits is an alcoholic or hydroalcoholic solution of volatile or aromatic substances. Suppositories are solid medications for insertions into body cavities, such as the rectal, vaginal, and urethral. Syrups is a liquid preparation in concentrated aqueous solutions containing sugar, usually sucrose. Tablets is a solid pharmaceutical dosage forms prepared by compressing and molding. Tinctures is an alcoholic or hydroalcoholic solution prepared from vegetables or chemical substances. Transdermal is a drug delivery is designed to be placed on the skin to give controlled release of a drug. Usually transdermal systems are in the form of a patch. The next thing that's going to be important to know is knowing your Roman numerals, how to convert. You're going to need to know that I is 1, V is 5, X is 10, L is 50, C is 100, D is 500, and M is millennium. I do have a video that talks about Roman numerals, so you can go ahead and look that video up. These are the directions of how to do Roman numerals that's also talked about in the video. The version that you're going to need to know is you're going to know that a centi stands for 100th, milli is 1/1000th, micro is 1/1,000,000th. Weight is measured in grams, volume is in liters, and length is in meters. However, you're not going to need to know meters for the pharmacy technician exam. Here's some more system of measurements that you're going to need to know. You're going to need to know that 20 grains is 1 scruple, 8 grams is 1 ounce, or also 480 grains, 3 scruples is 1 gram, or 60 grains, 12 ounces is 1 pound, or 5,760 grains. 1 grain is 65 milligrams, 1 pound is 454 milligrams, 1 kilogram is 2.2 pounds, 1 ounce is 28.4 grams or 30, 1 fluid ounce is 30 milliliters, 1 pint is 16 ounces, and 1 gallon is 3,840. 1 teaspoon is 5 milliliters, 1 tablespoon is 15 milliliters, 1 ounce is 30 milliliters, 1 pint is 473 milliliters. Are there any questions? All right, well, I'm going to go ahead and continue. There is a delay on this, so if I do see a question, I will stop at the end of the chapter, and I will go back to that question and answer that question. So this kind of goes back to the first week that we talked about, but this is going to be your temperature conversions. A formula that is very easy to remember that applies to everything is 5F equals 9C plus 160. So the things that we're going to talk about in this week are going to be your controlled substance and pharmacy law, antihypertensive medications, and ratios and proportions. So the Controlled Substance Act of 1970, this involved the DEA number. Any person who dispenses, manufactures, wholesales, or distributes a controlled substance must be registered with the DEA and have a DEA number. A DEA number is made up of 2 alphabet characters and 7 numbers. For example, this is an example DEA number. The first letter represents who is dispensing controlled medication. M stands for mid-level practitioner, wholesalers, or pharmacies. R is going to be wholesalers, and A or B is for all others. The second letter is the first letter of the person's last name or the first letter of the business. For example, the P above would be the prescriber's first initial of the last name. And I do have a video that talks about the DEA numbers as well. So if you want to go and look at one of those videos that talks about the DEA number, real quick, a quick summary of that is you add the first, third, and fifth number, then add the 8, 7th, and 9, 8, 7, and 9, multiplied by 2, add those together, it gives you 57. And when it gives you 57, the last number, that DEA number, should be that last number. So here's a few practice problems. Okay, so substance for controlled or schedules for controlled substances. So this can be scheduled drugs, class medications, controlled medications. They're all the same thing. So class 1 is an illicit drug that has no medical use and has high potential for abuse and addiction. Examples include LSD, marijuana, and heroin. Schedule 2 are drugs with a high potential for mental and physical abuse and addiction but have some medicinal benefits, usually made up of a narcotic and non-narcotic drugs. Examples include Percocet or Percodan for pain, Ritalin or Adderall for attention deficit disorders, and Oxycontin for pain as well. The Schedule 3 medication is a potential for abuse but a moderate to low physical dependence and a high mental dependence. These drugs are shown to have medicinal benefits. Examples include Tylenol with codeine for pain or headaches, Vicodin ES for pain, testosterone and Furanol for headaches. Schedule 4, or Class 4, is the drugs that have a low potential for abuse and a limited chance for physical or mental dependence and have known medicinal benefits. Examples include benzodiazepines and barbiturates such as lorazepam, diazepam, and Darvon. Schedule 5 medications are drugs that have a low potential for abuse and a very low chance of physical or mental addictions. They usually are cough suppressants such as Tylenol with codeine elixir and Phenergan with codeine elixir. So requirements for controlled substance are different than a regular prescription. Each controlled medication or each controlled prescription needs to have the full name of the patient, address of patient, date prescription was written, name and strength of drug, directions for use, dosage form, quantity to be dispensed, prescriber's DEA number, address, and signature. Control refills. A prescription written for a controlled substance for C3 and 4 cannot be filled or refilled after 6 months from date written or 5 refills. C3 through C4 cannot be refilled after 5 refills unless the prescriber gives authorization for a new prescription. C5s can be dispensed for the amount of time issued by the prescriber, good for 1 year. C2s can never be refilled. Prescriptions received by fax. Schedule 2 prescriptions may be transmitted by fax, but a hard copy must be presented to pick up the prescription. Schedule 3, 4, and 5 may be faxed, and the fax may serve as a hard copy. Now we're talking about laws. Now, with laws, it's important to remember the law, the year that it was enacted, and then also the general idea of what the law is. So the first law is the Pure Federal Food and Drug Act of 1906. Passed in 1906 by Congress, also referred to as the Wiley Act. Food preservatives and dyes being used in food processing were found to be harmful to the population. Also, manufacturers made claims for their cures that would not work. Opium, morphine, and cocaine were sold without regulation, no ingredients on labels, and no warning of misuse. The Act protected against misbranding and adulteration and to the purity of products. And I remember that I do have a video of these, and so on my YouTube channel. And so you can always just go look at those videos if you want to refresh. So a law is going to be, another law is the Federal Food, Drug, and Cosmetic Act of 1938. Passed in 1938, 5 years after 100 deaths due to poisonous solvent and elixir of sulfanilamide, and made manufacturers prove what was in their product and provide scientific evidence to its claims. Cosmetics and therapeutic devices were now regulated. The Durham-Humphrey Amendment of 1951, passed in 1951 as an amendment to the Food and Drug and Cosmetic Act. This gave requirements for prescription labels, prohibited refills, requests without the consent of a practitioner, defined which drugs could be over-the-counter products as and then drugs that the layperson could understand and did not have to be supervised by a physician. And that's what an over-the-counter product is. So the Kefauver-Harris Amendment of 1962. In 1962, the drug thalidomide was found to cause birth defects in babies in Europe. It was under investigation in our country at the time of incident. In response, the United States passed this amendment. It is required to sign patient consent forms for new investigational drugs. Drug manufacturers were required to prove the effectiveness of products. Required manufacturers to have good manufacturing practices, manufacturers to provide products updates and package inserts, and it also gave the FDA more power over clinical investigations. The Poison Prevention Packaging Act of 1970, the U.S. Consumer Product Safety Commission is responsible for enforcing the act. The purpose is to prevent poisoning in children, requires that most drugs must be packaged in a child-resistant package. There are certain medications that do not have to be packaged in child-proof containers. Patients may also request non-child-proof containers by signing a log or when requesting from the physician. Although a patient has a child-proof container, it does not mean it is child-resistant. The exemptions to the Poison Prevention Act is going to be the sublingual forms of nitroglycerin, liquid and tablets of sodium fluoride, oral contraceptives, acetaminophen and aspirin, potassium supplements, conjugated estrogens, and medroxyprogesterone. Now we'll talk about drug recalls. There are 3 levels to a drug recall. There's a class 1, which is an exposure or ingestion of product may cause serious adverse health effects or fatal harm. Class 2, the exposure or ingestion of a product that may cause reversible health effects but will not cause fatal harm. Class 3, exposure or ingestion of a product that will not likely cause harm. Class 3 drug recalls are typically for more of a cosmetic to the medication. So if the color's not right, those kind of things. So the FDA is not responsible for the drug recall, although they may request it from a company. Another law is the Medical Device Law of 1976. This requires companies to have a pre-market approval of medical devices. This was to ensure that the product was not making false claims and was not harmful to the public. The patient package inserts. The following require a patient package insert each and every time dispensed. Oral contraceptives, isoproterenol as an active ingredient, estrogen prescription products, DES, or diethylstilbestrol, when used from a post-coital contraceptive, IUD, progestational drug products. Another law is the Federal Anti-Tampering Act of 1983. Passed in 1983 in response to deliberate contamination of Tylenol capsules. All OTC products must have a tamper-resistant barrier that, if breached, can be recognized. Also, the barrier must not be able to be reproduced easily. Although a product may be tamper-resistant, it does not qualify it as child-resistant. The Omnibus Budget Reconciliation Act of 1990. This is also known as OBRA. This required Medicaid patients to be offered counseling, mandated records be kept about the patient and drug therapy for prospective and retrospective drug utilization review. The Dietary Supplement Health and Education Act of 1994. FDA has no jurisdiction over these products unless they are misbranded or adulterated. Examples would include most herbal and mineral products. Products must have a supplemental panel. Products can only make 3 claims on its labels as to what the product remedies or helps. Examples include disease, nutrient content, and nutrient support. A Material Safety Data Sheet, MSDS. This is OSHA, Occupational Safety of Health Administration, is a unit of the U.S. Department of Labor. A requirement for displaying the MSDS in the workplace where hazardous chemicals are used or stored. So the National Drug Reference Code is also referred to as the NDC, must be placed in the top third of the wrapper label, made up of 10 numbers in any of the possible configurations listed below. This 10-digit number is put on every drug product. Each number has a special meaning and purpose. The first segment identifies the manufacturer, the second segment identifies the drug name, strength, and dosage form, and the third and final segment identifies the package sizes. The UPC's number is on all other over-the-counter medications or products. United States Pharmacopoeia, or the National Formulary, enforces standards and specifications for purity, strength, quality, packaging, label storage, and occasionally bioavailability. USP is made up of a monograph for active ingredients and dosage form. NF is made up of excipients or inactive ingredients. A USP DI is 3 volumes of books. The drug informational for the healthcare professional, advice from the patient drug information in lay language, and approved drug products with therapeutic equivalent evaluations known as the Orange Book. The Orange Book is a very important book to become familiar with, a very important book to know. So when we're dealing with federal law versus state law, basically what this paragraph is saying is that you always want to follow the more strict law. If the state law is more strict, then you want to follow the state law. If the federal law is more strict, you follow the federal law. OSHA is the organization responsible for ensuring that workplaces are safe in the Occupational Safety and Health Administration. This organization requires that information be readily retrievable as the hazardous chemicals used or housed in the facility. The specifics of these chemicals are recorded on a material safety data sheet, which tells of storage requirements. Hazardous chemicals are defined as those that can cause physical damage and pose a danger to health. Explosive or flammable substances that are used and stored in pharmacies would be those that can cause physical harm, and many drugs, most notably chemotherapeutic agents, would pose a danger to health. It would be necessary to use a spill kit to clean and dispose of hazardous chemical and drugs. You want to look at the DEA 222 order form. The DEA 222 order form is when C2 medications are lost or stolen. No. Yeah, lost or stolen. No. I'm sorry, a DEA 222 form is when you're ordering C2 medications. They have 10 spots that you can only order 10 C2 medications on at a time. If you have 11 C2 medications, you need to have 2 separate sheets. Now on with the drugs. An antihypertensive agent. Hypertension is defined by having several blood pressure readings that are greater than 120 millimeter systolic and greater than 80 millimeter diastolic. Normal is considered 120 over 80. High blood pressure is a silent disease due to most people's inability in knowing their pressure is actually high. Chronic high blood pressure can lead to stroke, heart attack, kidney damage, and many other various problems. There are at least 3 ways to affect decreased blood pressure: remove fluid from the cardiovascular system, increase the diameter of the blood vessel, decrease the amount of force in which the heart is pumping. Ratios and proportions, there is a section on that that talks about that. So if you want to look at my other YouTube videos, you'd be able to see that. There's some practice problems. If you have any questions about the ratios and proportions, you can go ahead and ask, or you can watch my other videos. So week 3, more reviews. Today we're going to talk about the inventory and pharmacy workplace, anti-anginals and antiarrhythmic, percentage and concentrations. Inventory cost is a company would ideally like to have enough inventory on hand to fill every prescription it receives, but on the other hand, not so much inventory as to incur unneeded inventory costs. So the 3 things that are taken into account when dealing with inventory costs is the cost of space, the cost of drug products, and the value of money. The source of pharmaceutical products. The manufacturer is the entity actually producing drugs. A wholesaler sells but does not dispense to patients drugs purchased from most, if not all, manufacturers. Purchasing groups are multiple hospitals, pharmacies joining together to increase purchasing power. When a pharmacy agrees to buy most or all of their supplies from one wholesaler, the prime vendor wholesaler will provide a loyalty discount. Pharmacies can also purchase from wholesalers alone or buy from other pharmacies. Economic order quantity. The EOQ is a calculation that is used to determine optimum inventory levels for each medication as well as what inventory level reordering should occur. You don't have to worry about this formula, but just know how it works. So ideal the amount of inventory, reorder level, and emergency level. Inventory control and management. Placing orders. While computerized inventory and barcoding have made inventory more manageable, the technician's role in checking inventory in and out becomes all the more important in order to give those levels meaning, as they may affect the drugs are reordered. Barcoded and automated technology in the Want Book to document special order items. Drug formularies and policies. The Pharmacy and Therapeutics P&T Committee is made up of medical staff representatives and possibly administrators who decide which medication at a facility or in a medical plan will be covered and or available for dispensing. Their decisions are primarily based on the combination of cost and medical effectiveness. The Pharmacy and Therapeutics Group Committee is very important to know for the test. If a drug is to be added to a formulary when something is similar is already approved and included, it would exhibit one or more of the following characteristics. It'll either have better effectiveness, fewer side effects, better tolerated by patients, and lower costs. When instituting a formulary effectively, these benefits can and should be expected. Best available medication choice, decreased inventory items and amount, negotiated pricing on preferred medications. Restricted prescribing is limiting who can prescribe certain medications and usually limited to specialists within a certain field. For example, antibiotics may be limited to infectious disease specialists only. Automatic stop orders. This is generally applied to physician orders calling for a medication that are required adjunctive monitoring. Example, regular monitoring of liver counts. The medication cannot be restarted or resumed until the physician has ordered a renewal for the drug. By learning how prescription drugs are dated, we can easily monitor when they expire and dispose of them in a timely and proper manner. Expired controlled substances always require 2 witnesses to destroy to avoid diversion. The expiration date is usually dated month, year. For expiration dates for month and year only, the expiration is always on the last day of the month at midnight. Disposal of expired drugs. Controlled medications have special requirements. Drug recall. Keeping tight control of inventory allows for easy recovery of tainted supplies and help in notifying patients who may be affected by the recall. Theft and diversion of drugs. Theft or diversion of drugs will fall into one of these four categories. Be aware of what your supervisor expects of you to aid in avoiding and stopping internal theft. Robbery is with a weapon, usually during hours of operation. Burglary when the pharmacy is closed. Shoplifting is theft of non-prescription items, usually the primary responsibility of loss prevention. And internal theft. Keep track of money carefully when responsible and be aware of large disparities in inventory. Control medications especially. Quality assurance and control. The purpose is testing to be sure that the product provided are what we say they are, as well as double-checking our work is vital to providing safe products to patients and customers. An understanding of what can possibly occur helps the technician to learn what to look for in presenting errors, as well as catching them before they can potentially cause harm. So common types of errors that are found in prescriptions are going to be the incorrect interpretation of the prescription, incorrect entry of the order into the computer, incorrect medication picked from inventory, incorrect amount of medication placed in container, incorrect label attached to product, incomplete or improper auxiliary labels, prescription given to the wrong patient. So the quality control of solid oral dosage forms. These are checks typically done in the retail pharmacies on every prescription. Checked visually by a pharmacist against stock, and auxiliary labels checked for accuracy. So quality control of injectable and compounded medications. These are done less frequently, sometimes only on a sample of prepared medications, and usually in hospital settings. Usually requires expensive or time-consuming analysis of materials, so they cannot be visually distinguishable or measured. This is checked by the pharmacist. Proper procedures followed to avoid contamination or calculation errors. Being a successful technician means also being a successful worker. To do this, the technician needs to understand his or her role in the pharmacy, complete assignment tasks successfully, and contribute to overall company goals. Antianginals is the next drug. Angina pectoris is the characteristic chest pain caused by coronary blood flow that is insufficient to meet oxygen demands of the heart muscle. Angina is characterized by sudden, severe substernal pain. There are at least 3 causes of drugs used in the treatment of angina: calcium channel blockers, beta blockers, and organic nitrates. Organic nitrates is increased blood flow in the cardiac muscle by relaxing coronary arteries. Antiarrhythmic is the heart contains specialized cells which regulate the heartbeat. Dysfunction of the cells or electrical conduction of any number of sites in the heart can cause bradycardia or tachycardia. There are 5 classes of antiarrhythmics: sodium channel blockers, beta blockers, potassium channel blockers, calcium channel blockers, and others. Next is percentage and concentrations. There's also another video on that we talk about. It's important to remember that volume to volume is going to be measured in milliliters per milliliters. This is used to represent liquid preparations such as solutions, elixirs, and other active constituents. The weight to volume is going to be measured grams per ml. So 1 gram equals 1 ml. This concentration makes up a majority of the problems involving dilutions and concentrations. Any questions? Okay, we shall continue. The things that we're going to talk about in this week is going to be compounding, aseptic technique, flow hoods, hyperlipidemia, anticoagulants, antiplatelets, antidepressants, anticonvulsants, SIGs, and business math. So non-sterile, there's two different types of compounding, non-sterile compounding and sterile compounding. Non-sterile compounding is intended to be used by mouth or applied externally. Some examples are capsules, oral liquids, cream, ointments, emulsions, and pastes. These medications are placed in areas of the body where natural defenses can stop infections. Prescription balance. All pharmacies must have one on the premises as required by law. Most common is the Class 3 balance. There's also Class A to D balances, with A being more sensitive and accurate than B, and so forth. Note, when using a prescription balance, it is common practice to put the weight on the right pan and ingredient or the drug on the left pan. When using a Class A balance, do not transfer with hands. The oils from your hands will throw off the correct weight. Measuring equipment for liquids. Graduated or conical cylinders, beakers, micropipettes. Graduated cylinders are the most accurate, but conical cylinders are the easiest to clean. There is also meniscus to measure from, which is a concave surface. You want to read measurements from the bottom of the meniscus. Compounding equipment. You'll have mortars and pestles, spatulas, ointment slabs, funnels, weighing paper, filter paper, heat source. Mortar is the bowl, and the grinder is the pestle. Processing a compound. So there's different ways to process compounds. One way is through titration, which is the grinding of a drug solid utilizing a mortar and pestle to reduce the particle size or mix two or more solids in order to create a finer powder to make dissolution easier, keep a cream or ointment from feeling gritty, and ensure thorough mixing of solid ingredients. Other way is levitation, entails dispersing a drug solid into a small amount of mineral, oil, glycerin, or other liquids, and then incorporating this paste into an ointment. Geometric dilution is used to ensure mixing of a small amount of potent drug with a large amount of a non-potent or inactive compound. Dissolution. There are various techniques that can be used in dissolving a solid or solute into a solvent. Heating the solvent, reducing particle size by titration or levitation, solubilizing agents that coat the solute, or agitation of the mixture. Stability. There's various agents are used to hold the tablet or liquid a stable state for administration. So considerations for container use. Whether it's going to be child resistant, you don't ever put a injectable in a container. Container actions with the products, amber or light resistant containers, and appropriate size. So these are all the things that you need to take into consideration. Labeling requirements. Generic or chemical names of all active ingredients. Names of vehicles or the liquid used to make a solution or the ointment base used in compounding topical product. Other label requirements as required by law. So there's two different types of flow hoods, laminar flow hoods. There's the horizontal flow hood and the vertical flow hood. The horizontal flow hood is used to prepare sterile preparations that are non-toxic or chemotherapeutic, indicating that they must be vented to the outside or the air release must be filtered. The air is taken into the unit at the bottom, passed through preliminary filter, which removes the gross contamination, such as large particles of dust. Air is compressed and passed through a much finer filter called a high-efficiency particulate air filter, or HEPA filter. This removes virtually all of the particulate matter, including bacteria. This filter makes up the back part of the hood, and the air is forced up the back and blown to the front through the filter and towards the operator. This consistent flow of air toward the worker and out of the hood keeps bacteria and particulate-laden air from the room from entering the hood through the opening. And that's a picture of a horizontal flow hood. A vertical flow hood is also known as a biological safety hood. These are used to prepare toxic chemotherapeutic drugs, indicating that they must be vented to the outside or the air released back must be filtered. There are two types of vertical flow hoods, one with exhaust totally to the outside and the other which filters 30% of the air back into the room. This similarly works like the horizontal flow hood, except that the filtered air is taken in through a grill directly in front of the worker, just below the work surface. The air is pulled through the bottom, pushed up the back of the unit, and blown vertically down from the HEPA filter top of the hood. The front of the hood has an opening only large enough for hands and forearms and has a glass to protect the rest of the body from toxic drugs. Vertical airflow, protective clothing, and the configuration of the hood ensure the worker is not exposed to the toxic chemicals. This is a picture of a vertical flow hood, or a biological safety hood. So here are things that are important. So all work must be done 6 inches into the hood without any part of the body other than the hands and arms inside. Airflow must remain continuous. If turned off, one must wait at least 30 minutes before using the hood. More so, the work surface should be cleaned from side to side, starting to the back and work toward the front with 70% isopropyl alcohol. This is according to policy and procedure of the manual for the flow hood. You can also expect questions pertaining to this on the exam. So I would say mainly that it's going to be the 6 inches into the hood, and then you start it. You can't use it until 30 minutes after you start the hood. Also, that you use 70% isopropyl alcohol. So those are the 3 things that I would keep in mind from this slide. So flow hood procedures recommendations. So a direct path must be maintained between the filter and the area inside the hood where the manipulations are being performed. The hand should never obstruct airflow around the area where the needle enters the vial or ampule. Also, when pulling back the plunger of a syringe, the fingers should not come in contact with any part of the plunger except the flat part at the end. You wash hands and arms before compounding or re-entering the hood. Hand washing should be done for a minimum of 30 seconds with cleaner and water and contact with skin from the elbows down. Keep in mind, touching is the leading cause of contamination. Also, remove any jewelry from the hands and wrists. It is important that you keep your hands within the clean area of the hood as much as possible. Do not touch your face, hair, or clothing. So for the flow hoods, you want to, basically for this one, items should be placed no closer than 3 inches from the very back of the hood. In a horizontal laminar flow hood, all work must be performed at a distance of no less than 6 inches from the front of the head, and a distance of less than 6 inches. Laminar flow hood, air begins to mix with the outside air and contamination is possible. Avoid spraying or squirting solutions onto the HEPA filter. Always aim away from the filter when opening ampules or adjusting syringes. Outer pouches and wraps should be removed at the edge of the work area as the sterile contents are pulled into the work area. Never bring these items into the main work area. Don't ever put any large objects in the back because it could block the airflow. Remember, laminar flow hoods do not create sterility. The purpose of the flow hood is to maintain already sterile products. This is the aseptic technique. As you can see in these 2 pictures, the path is kept clear. So chemotherapy preparation guidelines. Protective work clothing is essential when preparing chemotherapy agents. The pharmacy should have detailed written guidelines on what staff members should wear when preparing chemotherapy products. The following protective work apparel should be utilized for preparing chemotherapy agents. Powder-free, disposable latex-free gloves. Use a double glove technique. One glove under the disposable gown, the other outside the disposable gown. The outer glove should always be changed if contaminated at any point while preparing products. And a protective disposable gown. Appropriate labeling. Final product should be appropriately labeled with patient-specific dose information or auxiliary labels that indicate the product contains chemotherapy agents. Final product should be contained in a sealable container such as a Ziploc baggie with chemotherapy and patient-specific labeling on the outside. Chemotherapeutic medications. Antineoplastic agents. These are also known as anti-cancer drugs, which are used in chemotherapy. Chemotherapy treats cancers by killing cells, thereby suppressing the active disease state. It is expected that 1/4 of the population will experience a cancer diagnosis within their lifetime, and cured cancer is commonly correlated to a 5-year remission state. Cancer is created when cells no longer control their cell division. Processes and divide uncontrollably at the sake of the body's normal healthy cells. Therefore, they do not serve their proper functions in the body anymore and are defined as cancerous. Next thing that you're going to need to know is going to be about a crash cart. In a hospital, a patient might crash or require immediate attention while experiencing a life-threatening event. The medication needed would be found in what is known as the crash cart. The crash cart is a cabinet on wheels that is kept locked up with a tamper-proof seal. To use the cart, the healthcare provider breaks the seal of the drawer and takes the required supplies as they are needed for the event. After use, the cart is brought back to the pharmacy where the drawers are restocked, rechecked, and sealed by a pharmacist. This is a picture of a crash cart. So crash carts are located in areas of patient care in case of life-threatening occurrences. Physicians, nurses, pharmacists, and respiratory therapists must become familiar with the contents of this cart. The Center for Nursing. Okay, so parenteral products are drugs administered via outside of the GI tract, primarily by injection. These drugs must be administered using a septic technique, meaning free of microbial contamination. So the 4 different reasons why parenteral drugs are used is unable to take drugs orally. This may be because they're in a coma, maybe they throw up, unconscious. Drugs might not be available in oral form. The 3rd one is emergency situation requiring immediate drug blood levels. And the 4th one is drug cannot be given via the GI tract. For example, insulin. The advantage of a parenteral administration, this is going to be a rapid onset. More predictable absorption into the bloodstream. Medication is able to avoid absorption and dissolution before entering the bloodstream. The disadvantage of parenteral administration is you can risk of infection. The rapid absorption means that the medical errors are magnified and hard to reverse. Unacceptable to many patients due to pain and psychological trauma are being given an injection. Requires sterility. All right. So this is the parts of the syringe. You have the needle, the barrel, and the plunger. The needle description, needle size is designated in 2 ways. You have the gauge, the smaller the number, the bigger the gauge, or the bigger the needle, and then the length of the needle. And these ranges from 3/8 to 3.5 inches. There's 2 different types of specialty needles that we'll talk about. There's the transfer needles, 2 needles attached together at their hubs to transfer sterile solutions from one vial directly to another without using a syringe. Filter needles contain a small filter to trap particles before they are administered through the needle when working with ampules. You must use a filter needle. Vials. Containers of injectable medications with rubber tops secured by aluminum bands and protected by plastic or aluminum tops. These diaphragms must be swabbed with alcohol prior to inserting the needle to ensure sterility of products inside and remove any particulate matter that might get pushed inside by the needle. After using alcohol, be sure to allow the surface to dry before puncturing the diaphragm. And these are just the parenteral routes again. The types of IV administration, you have the IV injection, which is a small amount of drugs administered via syringe in a small amount of time. And then you also have the IV infusion, which is a large volume over large periods of time, used for replenishment of fluids, nutrients, or as liquid vehicle for drug administration. May be continuous or intermittent. IV infusions are commonly administered with an IV piggyback or IV PB, with the PB portion hung in a bag slightly higher than the other solution in order for liquid to flow through. Characteristics of an IV solution. Now, the IV solutions must always be clear. They may be colored but not cloudy. One exception to this rule is a fat emulsion for TPN administration. They must be sterile, as close to neutral in pH range as possible, and contain the same number of solute particles as blood. Now, these temperature requirements I think, would be important to know. You have excessive heat, incubator, room temperature, refrigerator, and freezer. You'll need to know the range of each one of these. Hyperlipidemia. These drugs are used to lower the LDL, triglycerides, or total cholesterol. There are strong links between high serum cholesterol levels and cardiovascular mortalities. Factors that contribute to hyperlipidemia include obesity, inactivity, cigarette smoking, excessive alcohol intake, high carbohydrate diets, and genetic disorders and diabetes. Anticoagulants and antiplatelets. These drugs are used to stop, slow, or reverse the coagulation process. When blood clots form, they travel to various organs, causing such disease states as stroke in the brain, myocardial infarction, this is a heart attack, or thrombosis, this is a vein clot. Close monitoring of patients taking these drugs is essential, or the patient could bleed to death. Antidepressant is a tricyclic antidepressants. These drugs work by inhibiting the reuptake of... Okay, you don't really need to know that. Anticonvulsants is epilepsy, or a seizure disorder, is a CNS disorder characterized by abnormal or uncontrolled bursts of electric activity within the brain. When the impulses surpass the normal threshold in the brain, abnormal movements or perceptions frequently occur. All right, so another thing that you're going to need to know is SIG codes. There will be problems on the exam where you're required to figure out SIGs and possibly make calculations based upon them. For example, a physician writes a prescription for Lotensin 1 BID 30. What quantity would the pharmacy dispense? So 2 tablets a day for 30 days, because 1 BID is 1 twice a day. And that number 30, that can be tricky. That might be a bad example because the 30 could either be the quantity of 30 or the day supply of 30. Usually if it's the number 30, it's the quantity. So for this one, we see 2 tablets a day for 30 days. That wouldn't be right. That would be a bad example. So it would actually be 15 because it's twice a day for 30 tablets. That'd be 15 tablets. Here's some more SIG codes that are going to be important to know. These have to do with frequency. And here's some more. Frequency and route. All right, so now some business math terms. AWP, stands for the average wholesale price. This is the price the medication was purchased for by the pharmacy, hospital, or wholesaler and will typically be sold at a different price. Markup or gross profit. This is the difference between the AWP and the selling price. Do not confuse this with the percentage markup. The actual markup is a dollar amount. Percentage markup, this is the percentage that the pharmacy uses to determine the markup amount. For example, 50% markup on a $2 medication would be $1. There's a term called overhead. This is the amount of all the costs incurred of operating the pharmacy. Markup amounts are generally used to pay for these costs. There's professional fee. This is the flat fee the pharmacy will add to the price of the medications. It is typically added after the markup and is usually referred to as the dispensing fee. Gross profit is the portion of the markup amount that is left after the overhead has been subtracted. This is the profit after expenses. Retail is the price paid by the patient. This is calculated by adding the markup amount to the average wholesale price. Wholesale, this is the price that the wholesaler charges to the retailer. And I do have a video that talks about business math on here on my channel, so you can go ahead and take a look at that. If you have any questions about that, feel free to go ahead and ask now while I go ahead and review this next section. Okay, and I did go ahead and I opened up the chat, so if you guys have any questions, you can ask the chat here. So there's 2 different places to ask questions if you have any. All right. Week 5. So I'm not going to really read all these slides. I'll just kind of tell you the general idea of what you'll need to know. I won't talk about exactly what you need to know. There's plenty of slides that you can go online to look at for these for this information. But the physiology is the study of the human body and its organ systems. If you think of it as a circular and interconnected by nature, you can put it in perspective and understand it better. We will describe physiologic system individually, possibly making it seem like each system is independent of the other. So the human body essentially is a collection of tissue, muscle, nerves, and bones. Each is incredibly specialized and complex and always tries to maintain a constant state of balance known as homeostasis. When this balance is disrupted, a host of symptoms and ailments may occur whereby medication may be utilized in order to stabilize the disruption. By working through the dynamics of physiology, which is the genetics, biochemistry, etc., drugs can help bring you back to normal homeostasis. So the integumentary system, that's going to be basically your skins, nails, hairs, and sweat glands. Skeletal system is going to be the bones, cartilage, joints in your body. Muscular system is the muscles. Nervous system is going to be your brain, spinal cord, and the sensory receptors. Endocrine system is going to be your pituitary gland, thyroid gland, adrenal gland, pancreas, testicles, ovary. Now, some of these, they might fall in different categories, and so you can kind of find both of them. So the cardiovascular and circulatory system, this is going to consist of the heart, arteries, veins, and capillaries. all which carry oxygenated or deoxygenated blood throughout the body. The respiratory system is going to be your sinus, your throat, your larynx, your trachea, your lungs. The digestive system, this is going to be your stomach, liver, gallbladder. You just want to basically kind of read what these are and kind of get a better understanding of what they do. The excretory system, this is going to be your kidneys, urinary bladder, and ducts which carry urine. Reproductive system, ovaries, vagina, mammary glands, and other structures in female, and testes, prostate gland, penis, and other structures in males. Those are two pictures of the reproductive system. Lymphatic system returns excess fluid filtered from blood vessel capillaries. Now, pharmacotherapy, this is when homeostasis is disrupted and diseases can take hold. Treatment intervention is necessary. There are many ways to correct a disease state beyond the typical treatments of medicine. Today, there are numerous trends in alternative medicines, tapping into Chinese techniques, chiropractic, herbs, and other natural pharmaceuticals. Evidence of their effectiveness is always debated, but it could be argued with health is a state of mind. We will focus, however, on the typical treatments of Western medicine consisting of the following. Lifestyle change. This can be anything to do with your diet, exercise, and physical environment. Have a profound effect on the body's health. Physicians use diet and exercise to help accentuate medicinal treatments. Risk factors might be alcohol, illegal drugs, tobacco, and other factors can be eliminated to decrease the susceptibility to diseases such as cancer, heart malfunction, and diseases. Surgery. This treatment can be used to correct or destroy causes of specific diseases. Pharmacotherapy uses prescription, non-prescription, or alternative medications to treat disease states. So pharmacokinetics. This is defined as the study of drug movement throughout the body. Doses of drugs are calculated using various mathematical models to gain a desired therapeutic effect. Other therapeutic agents can have a possible toxic effect, which is invariable related to every person. What is a proper dosage in one person could be toxic to another. By calculating the correct dosage and trying different therapies or drug regimens, we can lessen toxic effects across the board. There's 4 different ways that the drugs move throughout the body. You have absorption. The process of a drug entering the blood. There are various ways in which this occurs, such as inhalers, transdermal patches, or by mouth. The drug is then transported to the blood via active sites. Intravenous doses skip absorption altogether by going straight into the bloodstream. Distribution. The movement of the drug through the blood and into various tissues or cells where it exerts its effect. Mathematical equations and models sort the blood into various compartments: blood, brain, and fat tissue. The movement of drug through various compartments is its volume of distribution. Metabolism. The chemical changes a drug undergo due to being processed by the body. The liver is the main metabolizing organ, which contains various enzymes. Excretion. This process through which the drug or its metabolites leave the body, usually in the form of urine or feces and sometimes the lungs. So drug misadventures, this is basically going to be anything that can go wrong with drugs. As a pharmacy technician, you will also have a hand in the prevention. In essence, you act as the eyes and ears of the pharmacy, working to help the pharmacist do the best job possible. When errors are made, they are known as the drug misadventures and consist of the following. The adverse drug reactions. Expected in a portion of patients on a given drug as extensions of its desired effects, sometimes referred to as side effects. The anaphylactic allergic reactions. When patients react to a drug as an allergy, an example is So anaphylactic allergic reaction is when patients react to a drug as an allergy. An example of this might be someone who has an allergy to penicillin. Prescribing errors. When a physician may misdiagnose a condition or write a prescription for the wrong dose, agent, strength, route, or administration or duration of the therapy. Dispensing errors. The duty of the pharmacist is to make sure that the correct drug is dispensed to the correct patient at the correct time, strength, quantity, and in the correct dosage form. If the pharmacy fails to meet all these criteria, an error has occurred. Administration errors. This occurs at the time when the patient, nurse, or other caregiver makes a mistake in taking or giving the medication to the patient. It also occurs because the patient may fail to take the medications as directed. All right, so now on to the medications. You have the analgesics, which is you have narcotic analgesics. These are used for the relief of pain by binding to opiate receptors in the CNS. These medications cause drowsiness, depressed respiratory function, constipation, and should not be taken with alcohol. There's also potential for addiction. Naloxone is a narcotic antagonist, sometimes used in narcotic overdoses. Then you also have the non-narcotic analgesics and the antipyretics. These are used for the reduction of pain and fever, with some agents possessing anti-inflammatory effects. These drugs work by inhibiting the synthesis of prostaglandin or by inhibiting the substances that sensitize pain receptors to mechanical or chemical stimulation. These drugs produce anti-inflammatory, antipyretic, and analgesics effects through inhibition of prostaglandin synthesis. They are not cox-specific and can be damaging to the GI tract. To minimize GI comfort, you want to take these medications with food or milk. Patients with peptic ulcer disease and GERD should consider other analgesics. Caution should be taken by those patients taking anticoagulants. So in these parts where I'm talking about the drug class, whenever there's a note, I would pay special attention to those. So the analgesics, or the COX-2 inhibitors, these drugs are specific for the COX-2 receptors. They are believed to cause little or no GI damage. Now on to the math. There's video about the allegations, dilutions, and IV rates. If you have any questions about those, feel free to ask. If not, you can go ahead and continue to look at the other YouTube videos that I have created. Week 6. Hang in there. We got 2 more weeks left. We're doing great on time. So the things to know is the roles of a pharmacy technician: respiratory drugs, anti-infectives, hormones through GI tracts. Through GI drugs, mill equivalents, Young's rule, Clark's rule, and BSA. So I'm just kind of skim over this and point out the important parts. I'm not going to read all these. If you want, I guess you can always just pause the videos. I believe you're able to, and go ahead and read them as I continue. So before working as a pharmacy technician or certified pharmacy technician, an individual shall be 18 years of age or older, have a high school diploma or equivalent, and complete a training program as specified in subsection J at the pharmacy of employment. If you have any questions on whether you need to complete a training program, you can go ahead and message me. Leave something in the messages, and I will go ahead and let you know if it is required in your state. So you need a sign understanding that you know your policies and procedures in the manual. I'll go ahead and let you read all these. When you have the test, if there's ever a multiple choice question, you need to remember that as a pharmacy technician, your first obligation is to the safety of the patients. So if you have a question and you're not sure what the answer is, you should ask yourself which is the most safe for the patient. And that is generally the correct answer. So prescription dispensing procedures for accepting a new written prescription, accepting a refill request, drug product selection, counting and pouring, labeling, and refill authorization. Computer data entry procedures for new and refill prescriptions, patient's drug allergies, drug-drug interactions, drug-food interactions. All right. Something else that's going to be very important to know and understand is HIPAA. On February 20th, 2003, HHS released security standard regulations requiring covered entities to implement administrative, physical, and technical safeguards for PHI that is maintained or transmitted electronically. These safeguards are to apply not only to electronic information being transmitted, but also electronic information on storage. So some terms that you're going to need to know for HIPAA is going to be the PHI, which is the Protected Health Information. HHS is the Department of Health and Human Services. TPO is the Treatment, Payments, or Healthcare Operations. OCR is the Office for Civil Rights. Covered entities, those providers who conduct healthcare business electronically using PHI. Business associate, entity or person who provides functions, activities, or services for a covered entity involving PHI use. So this was implemented during the Clinton administration. This protects all patients from having their information leaked out to other people. So the three components to this act include 1, privacy, 2, transaction standards for electronic data transfer, and 3, security regulations deadline for compliance of the privacy rules for 4/14/2003. So who must comply with HIPAA? All healthcare providers who transmit health information electronically, including health plans, healthcare clearinghouses, and providers who conduct healthcare business electronically. So providers must obtain patient consent in order to use any health information to carry out TPO. There are some exceptions to this rule. Pharmacies do not need written consent to fill a prescription for a new patient that is called in by a doctor's office. What about minors? Parents are considered personal representatives of minor children with some exceptions. When state or other laws does not require parental consent for minors, when court determines that someone other than the parent should make treatment decisions, and in cases of abuse or neglect. So the penalties to violating HIPAA: fines can range from $50,000 and 1 year in prison for any violation to $250,000 and 10 years in prison for intending to sell or disclose PHI. Now, interesting side note that I'm going to go ahead and add on here is that there was this one pharmacy that I heard about who someone went in and stole some information from, so a whole bunch of patients' information, and they broke HIPAA. They tried to blackmail the company and wanted to get money for getting all the information back, and they ended up getting arrested and huge fines and tons of prison time. So don't do that. That's not good. So who enforces the HIPAA? So the HHS Office for Civil Rights. Pharmacies must develop a notice of privacy practice that must be posted prominently at the practice site and on any website. All right, so now into drugs. The respiratory drug. Respiratory medications are commonly used for patients with asthma or other breathing disorders. Anti-infectives. In general, the agents belonging to this category are used to either kill bacterial or inhibit the growth of bacteriostatic of disease-causing pathogenic organisms. Since bactericidal agents are only effect against growing organisms, their effect are diminished when administered with bacteriostatic agents. Completing the full course of therapy is of the utmost importance, and therefore the auxiliary label stating "finish all medication" or the specific duration of therapy should be placed on the prescription vial. Hormones through GI tract. Thyroid hormones affect protein synthesis, glucose, and carbohydrate metabolism, lipid metabolism, energy storage, body temperature, and various other physiological processes. When the thyroid does not secrete enough hormone, replacement therapy is required. And these drugs that we're going over, you can always just go online and Google search them. I'm sure that there's plenty of websites that you can go look at for these medications. The male hormone, these medications are used to either supplement or replace the male natural hormones or can be used for menopausal disorders and female HRT. All right, I also have a video that talks about the milliequivalents. It might sound very confusing, but once you kind of watch the videos, you'll have a better understanding of how it works, and it'll make a lot more sense. So I'm not going to go ahead and try to explain it on here unless you have a specific question for it. I would just go ahead and guide you to the videos, the other videos that I've made. As well as the Clark's-Young's rule and the BSA. So there's videos for all four of those. Week 7, healthcare in the United States. So this is the last chapter. Looks like we will be finishing early. I will give a few minutes at the end to ask any questions you might have about anything. And I will answer them. So I'm going to go ahead and skip through and kind of pick out the important things of the healthcare section. So the first part to know is called Medicare. Medicare is a federal healthcare program for the elderly and disabled. As part of the Social Security Amendments of 1965, the Medicare legislation established a health insurance program for aged people to complement the retirement, survivors, and disability insurance benefits under the Title II of the Social Security Act. In 1973, other groups became eligible for Medicare benefits. Persons who are entitled to Social Security or railroad retirement disability benefits for at least 24 months, persons with end-stage renal disease requiring continuing dialysis or kidney transplant, and certain otherwise non-covered age persons who elect to buy into Medicare. Today, Medicare is the nation's largest health insurance program. The program is administered by the Center of Medicare and Medicaid Services. So Medicare consists of two primary parts, Medicare Part A and Medicare Part B. And we'll talk about Part A and Part B in just a second. Right now, actually. So Medicare Part A, this is going to be the hospital insurance. This provides coverage with no premium costs for inpatient hospital services, skilled nursing facilities, home health services, and hospice care to all persons eligible for Medicare. This part of Medicare is financed primarily through a mandatory payroll deduction, FICA tax. Almost all employees and self-employed individuals in the U.S. work in employment covered by the Medicare program and pay taxes to support the cost of benefits for aged and disabled beneficiaries. Medicare Part A. Again, cost sharing is required. For hospital care, the beneficiary's payment share includes an annual deductible. This covers the beneficiary's part of the first 60 days of each spell of inpatient hospital care. If continued inpatient care is beyond the 60-day, additional coinsurance payments, $210 per day in 2004, are required through the 90th day of the benefit period. Medicare Part B, you're going to want to know that this is the supplementary medical insurance, assist in pay of cost of physician services, outpatient hospital services, medical equipment and supplies, and some other health insurance and supplies. Part B is financed through premium payment, which is usually deducted from the monthly Social Security benefit checks, and 2, through contributions from general revenue of the U.S. Treasury. Medicare Part C, Medicare Advantage program, known as Medicare Part C, began in January 1999. As part of the program, Medicare beneficiaries who have both Part A and Part D can choose to get their benefits through a variety of risk-based plans. The primary Medicare Advantages plans are coordinated care plans, which include health maintenance organization, HMOs, provide sponsor organizations, PSOs, and preferred provider organizations, PPOs. Other certified public or private coordinated care plans and entities that meet the approved required standards. Another thing is going to be managed care. Managed care plans function on a different basis different from regular fee-for-service plan covered under Medicare. Under managed care plans, the Medicare beneficiary selects a specific HMO or other plans with a service area for comprehensive healthcare services. It is essential to the managed care concept that a select plan coordinate all of the healthcare services for that person. Managed care plans receive a per-person payment for Medicare that is predetermined based on a formula that is established by law and the demographic characteristics of the Medicare beneficiaries enrolled in their plan. Generally, this is the percentage of the average adjusted cost per person for the respective region of the country. There's also something called Medigap insurance. Although there are certain restrictions, limitations, and differences from the fee-for-service plan, the managed care plan's fixed monthly premiums and cost-sharing structure help to provide more predictability of out-of-pocket costs for the beneficiaries who do not have Medigap insurance. Medicaid is the largest source of funding for the medical and health-related services of America's poorest people. In 2000, it provided healthcare assistance to more than 35.6 million persons at a cost of $210.8 billion. Within broad national guidelines established by federal statutes, regulations, and policies, each state establishes its own eligibility standards, determines the type, amount, duration, and scope of services, sets the rate of payment for services, and administers its own programs. Medicaid does not provide medical assistance for all poor persons. Even under the broadest provisions of the federal statute, Medicaid does not provide health care services even for very poor persons unless they are in one of the designated groups. Of these designations, low income is only one test for Medicaid eligibility for those within these groups. Their resources are also tested against threshold levels as determined by each state within federal guidelines. States generally have broad discretion in determining which groups their Medicaid program will cover and financial criteria for Medicaid eligibility. Medicaid managed care. A significant development in Medicaid is the growth of managed care as an alternative service in the traditional fee-for-service system. Under managed care systems, health maintenance organizations, prepaid health plans, or comparable entities agree to provide a specific set of services to Medicaid enrollees, usually in return for a predetermined periodic payment per enrollee. Medicaid managed care programs are growing rapidly. So types of managed care organizations. The HMO is the most common MCO. There are various types of health administration organizations such as the staff, group practice, and network independent practice association, and direct contract models. These models are different by how the HMO is linked to the provider organizations, which differ from HMOs by the provision services. And if you want to Google managed care organizations models, that you'll be able to find something from there. I'm just going through and picking out the important ones. If you want to stop and read all this information, you're more than welcome to go ahead and pause it as I'm going along, taking a look. It would never be a bad idea to read everything that I'm skipping over, just so you know. I'm just looking for the things that are going to be important for the actual test. So, introduction to drug action. A non-prescription drug is a drug which may be sold without a prescription and which is labeled for use by the consumer in accordance with the requirements of the laws and rules of state and federal government. Non-prescription drugs are also called over-the-counter or OTC drugs. Prescription drugs are those that are safe for use only under medical supervision and require a prescription from an authorized prescriber such as a physician or dentist. So in this age of increased awareness about patient safety, there is much attention brought to sound-alike or look-alike names. Now this is very important. I would pay very particular attention to this. Some drug names, both generic and trade, can be confused due to a similarity in the spelling or pronunciation of the name. For example, hydroxyzine and hydralazine are often confused with each other. Some manufacturers use capital letters within the drug name to help show the difference between the two agents. This is also known as the tall letter technique for deciphering or for determining a look-alike, sound-alike drug. So the hydralazine and the hydroxyzine both start with the hydra and end with a zyne. So they highlighted or they capitalized and bolded the middle letters that are different, so you can look at them and you can determine, oh, well, that's going to be different. So although the trade names of drug may vary among manufacturers, each drug has only one chemical and one generic name. The FDA requires that a generic version of a drug have the same active ingredients as the original product. The generic drug must also be absorbed in the body at the same rate. The FDA publishes approved drug products within therapeutic equivalence evaluations, commonly known as the Orange Book, which cites the agency's evaluation of how each generic product's therapeutic effect compares to the therapeutic effect of the reference brand name product. The pharmacists use the information on therapeutic equivalence when selecting generic drug products in clinical practice. So bioavailability is the term used to describe the rate and extent to which a drug is absorbed into the bloodstream. There are several factors that can affect the bioavailability of a drug, including the way in which the drug is manufactured, its chemical and physical properties, and the physiology of the patient taking the drug. Drug products are designed to release the active drug at a desired rate at once it is taken into the body. Two drug products may have the same active drug compound, but they may contain different inactive ingredients that can affect the rate and extent of absorption. Drug products are considered bioequivalent when they not only contain the same active ingredient but also produce virtually the same blood levels over time. Bioequivalence ensures that the product are therapeutically equivalent and thereby are interchangeable. So adverse effects and toxicities. Adverse effects can be described as undesired effects that occur when drugs are administered. These adverse effects can be divided into two groups, side effects and toxicities. Side effects are undesirable pharmacological effects of a drug seen at therapeutic doses. Side effects are an unavoidable part of a drug's action. Some examples of side effects include drowsiness caused by antihistamines, constipation caused by narcotics, and dry mouth caused by anticholinergic agents. Toxicities, on the other hand, are harmful to the body. Toxicity can occur when the drug dose exceeds the recommended range, when therapy exceeds the common recommendation duration, or if a drug is not monitored properly. Most toxicities are avoidable when drugs are properly and carefully monitored. Some examples of toxicities include kidney damage caused by aminoglycoside, antibiotics, or ulcers caused by aspirin. When two or more drugs are taken at the same time or in the same time interval, they may interact in ways that can be good or bad. There are three enhancements of drug effects: additive, synergism, and potentiation. An additive response occurs when two or more drugs combine to result in a response that is the sum of drugs' individual responses. Synergy occurs when the response is greater than the sum of the individual drug. Potentiation occurs when a drug lacking an effect of its own increase to the effect of a second active drug. And here's an example of how the drug interaction. So additive, it's effect A plus B. It gives you effect A and effect B. Synergism is the effect A plus B is greater than effect A plus B. And potentiation is the opposite. So that's actually backwards. All right, so safety and efficacy. The two goals in the drug development are drug efficacy, how well a drug works, and safety. All drugs can cause harm as well as help. The margin of safety for medication is called therapeutic window and is the distance between the usual effective dose and the dose that will produce a severe or life-threatening side effect. Ideal drugs are those that are effective and safe. An example would be penicillin, except for those individuals who are truly allergic to penicillin. It is a very safe drug. Even in large doses, it is virtually non-toxic. So in conclusion, medication therapy involves using the drugs that will effectively treat a patient based on how the drug acts in the patient's body and how the body absorbs, metabolizes, distributes, and eliminates the drug, and how the patient individual characteristics affect the drug activity or disposition. By carefully monitoring a patient's drug therapy, adverse effect, toxicities, and drug interactions can either be avoided or minimized.